Science, Society, and Policy, with a focus today on global responses in COVID year one, key questions for research, policy, and society. I am Kathleen Fisher, and I'm president of American Friends of the Alexander von Humboldt Foundation, and we're very pleased today to be co-hosting the session with the Alexander von Humboldt Foundation. But before I introduce the Secretary General of the Foundation, I wanted to go over a few technical details. You should all know these by heart after 1 year of Zooming, but let me go over them. First of all, during the presentations, we would ask you to turn your video off just so that we have stability. But then for the discussions, it would be great if we could have videos on, but audio off so we can see people. Second, we would invite you to make any comments that you have or questions via the chat function, and we'll try and bring in as many of those into the discussion as possible. Third, if you have any problems or technological questions, please use the email link that's going to be available in the chat function. Alexis, my colleague, is going to be there to help any of you who have problems. And finally, please be advised that we will be recording today's session so that Humboldtians or others who are not able to join us today might have access to the discussion later. And with no further ado, it's my great pleasure to introduce the Secretary General of the Alexander von Humboldt Foundation, Dr. Enno Aufderheide. Enno.
Well, thank you. Thank you, Kathleen, and thank you to the American Friends for giving me the honor to present a brief welcome at today's inaugural session of the Humboldt Digital Dialogues. It's a key strength of the Alexander von Humboldt Foundation to have a network of excellence, a network of cooperation, of trust, and a network that spans, obviously, across countries and disciplines. And today's event is hosted by the American Friends of the Alexander von Humboldt Foundation, and therefore I want to thank you, Kathleen, and also your team, and all Humboldtians involved in setting up this new format of transnational exchange on urgent topics of our time. When the Corona pandemic hit us all last year, Humboldtians across the world were affected. Everybody was affected and still is. 12 months later, we are still in a crisis mode, but we have a perspective. We have a perspective that we owe to scientists, to international scientific collaboration, and to the biotech industry, because they created vaccines, they created hope. And at the same time, if we look at the interface between science, society, and policy, the past 12 months have given us much food for thought. We have seen how urgently important a dialogue between science, civil society, and policymakers is, but we have witnessed how many obstacles there are for such a dialogue. We have seen how urgent international collaboration and global responses to a global pandemic is, but we have witnessed the resurgence of nationalism. And we have seen countries succeed and fail in addressing the crisis, sometimes both at the same time, but we haven't been able to learn sufficiently from these successes and failures. So really much food for thought and much to reflect and to learn. And I'm convinced that the International Humboldt Network has a special role to play in this process of reflection and learning. And I wish to end by again thanking our American friends for bringing us together. I wish to thank today's speakers for their insights, for the insights they are making possible for us. And of course, I thank everyone in the audience joining us, not just from the United States and Germany, but from many other countries as well. So I look forward to the discussion and the next dialogues also in this series. Thank you.
Thank you very much, Enno. I'm so glad that you could be here, and I am so glad that we also have global Humboldtians. As Enno, as you've said, we think this is the ideal platform for this dialogue because it crosses national boundaries, sectoral boundaries. Most people are in academia, but we also have people not in academia, in public policy or other fields. And of course, it is also transgenerational. So we're very excited about this. As you mentioned, this is a series, the opening session of a series that will explore the interactions among the worlds of science and scholarship, policy, and also society, and how that interface influences our ability to respond to deal with complex global society-wide crises. Among other issues in the coming sessions, we are going to look, for example, at the influence of cultural factors on our respective crises responses, trust in science, how we can better communicate science to society, the integration of ethics and norms into science advisory systems, the challenges faced by the COVID generation of scientists and scholars, and where we will be in the end with regard to international collaboration. Critical part of each session is also going to be an exploration of what Humboldtians, as individuals, as sub-networks, or as global network, might contribute to this dialogue about the science society policy interface, either in research or public policy, whatever fields they are in. It's now my great pleasure to introduce our two expert speakers for today's dialogue. The invitations you received contained more information about their biographical information, so let me be brief here so we have more time for our dialogue. Our first speaker is going to be Professor Anke Hoeffler, the Alexander von Humboldt Professor of Development Research in the Department of Politics and Public Administration at the Universität Konstanz. Professor Hoeffler is a principal leader of the global research project Life with Corona. Our second speaker will be Dr. Bill Colglazier. Dr. Colglazier is the editor-in-chief of Science Diplomacy and a senior scholar in the Center for Science Diplomacy at the American Association for the Advancement of Science. From 2011 to 2014, he served as the fourth Science and Technology Advisor to the US Secretary of State. And we're also very proud to claim Bill as one of our own. He is the chair of the Board of Directors of American Friends. We've asked Professor Hoeffler and then Dr. Colglazier to speak for about 10 minutes each. We'll then begin a discussion. So I hope you will contribute your thoughts to that discussion via the chat function. And please, just a reminder that we are recording the dialogue. And with that, let me turn it to Professor Hoeffler. You have the floor.
Thank you very much. Let me try and share my screen because I've got a short presentation prepared for you. And I hope you can see what I can see. Yeah, good. So Kathleen is nodding. So thank you very much for this generous invitation and the introduction. So our Life with Corona survey is a global research project. It's still ongoing and you can take part in it and share it. Yeah. So we've got partners in many different places. So my main partners are Professor Tilman Brück in Berlin and Professor Patricia Giustino at the UN University in Helsinki. Supporting institutions, of course, include the Alexander von Humboldt Stiftung, because through their generous support, I'm able to conduct this research. And we've got partners all over the world to help us with this ambitious project. Okay, what are the fundamental questions we want to address here? So, what implication does the pandemic have on the daily lives of people around the globe? And how do not only the sort of health worries that people have and the sort of effect on their physical health because they contract COVID or family members fall ill and die have on their daily life. So how do all of these restrictions impact on them? And how do these things change over time, especially now that vaccinations, we were talking about it a little bit earlier as we were waiting for people to come in, testing and vaccination regimes, how this is going to change things. And of course, there are going to be different sort of cycles in different countries because it looks already very hopeful in Israel and the United Kingdom, and Germany's lagging behind a little bit, and lots of people vaccinated in the United States. But India in particular looking really very worrying indeed at the moment, as does Brazil, two very populous states. So we launched over a year ago. It's, as I said, an online survey where you can fill in a questionnaire, and we've got 4 core areas. So one is about exposure to corona. So have you had it? Do you know anybody who had it? These types of questions. How did it affect you economically? How does it affect your view on society and politics? Because this is important. If you don't trust your government, you are less likely to adhere to the measures that have been taken. And then because we're an interdisciplinary team, we've got a good section on mental health questions. So the first phase was from March last year to October. We had a half-year report and then put in some new questions because things change a little bit over time. And we are in the process of starting a third phase where we're going to have more questions on vaccinations and tests. The survey is available in 27 languages, and that has led to 32,000 responses in over 130 countries. We published the insights from this ongoing survey on our website. Please take a look, but I'm also going to sort of just give you a little bit of share a few of these insights with you. So how worried are you about contracting COVID-19? And the lower bar shows you the response about how worried am I about getting ill. And so about half of all people say that they're worried about them falling ill. But 3/4 of people are worried that their family member or friends will fall ill. And that is actually very similar across the societies that we've looked at. So people are more worried about others than themselves. And also another characteristic is that women are more worried about others than men. And the old age groups are also more worried about others than themselves. Interesting finding. Okay, so by age group, so each bar is a different age group. So how worried are you? Well, we all know by now that if you're older, you're much more likely to contract it and have not necessarily contract it, but then also have a more serious illness if you do contract it. So people have understood this. They are more worried the older they are. But look at that. What's your overall stress level? So there are sort of ways how psychologists ask about stress, and the stress is lower in the higher age group. Those that are really worried about and quite rightly worried about their physical health are actually much better able to cope with the stresses of pandemic life. In the phase 1, so remember this was from March last year to October last year, so we were still sort of in the race of developing vaccines, but it seemed some way off then. And we asked people, if there's a vaccine, who should get it? And the blue bars show my country. That was an option, my country should get it first. And if you look to the right, you see the bars for the United States. And it was actually out of all the countries for which we had responses or decent amount of responses that we could do country analysis, it was the country where most people said, my country first. Okay. We can also look at things over time. So we're looking at Germany only here. The red line gives you how the infection numbers increased over time. So this is from September last year to the end of last year. And infection rates rose. We had, relatively quiet autumn, and then they really raised up. And we asked people what measures they take to prevent infections. And this is the number of contacts I'm tracing here with a green line. And that really went down. So people really restricted their contacts with other people. And the most recent uptake there is, of course, Christmas. So over Christmas, people saw more, had more contacts. And do these preventative measures vary across countries? So the last slide was only about Germany. And we asked about various different measures about not only how many people do you meet, but sort of do you wear a mask and do you avoid public transport, those kind of avoidance measures. And Brazil, interestingly, people report a lot of avoidance measures here, whereas the US sort of, yeah, they've got quite a few. These bars show that because it's an online survey, of course, it's not representative, so we need to weigh these responses. And so we've got some confidence intervals here. But look, Germany and Switzerland and Austria are really to the far right here. They are not taking many measures as some other countries do. So unsurprisingly, of course, people report that they've had negative income shocks. So these are the red bars. Yeah, some people sort of say my income declined, and this is quite different across countries. Argentinians sort of told us that almost 40% their income declined. Let's not forget that they are sort of lucky people like myself who got an Alexander von Humboldt professorship and are German public civil servants, and my income did not decline. Yeah, so I'm in the nice light gray area. So Argentinians had changed for many people. Then Germany, it's about a quarter of all people. In the United States, only 19. And I'm not going to talk too much about what might be behind it, but I'll leave that to the discussion. But of course, the United States had a very different support package. Sorry. So we can see here that across all countries, we had more of an income loss for self-employed people. Okay, and then this is one of the last slides I'm going to show you is if your income decreased, so this is the sort of top bar, they've got the highest percentage of those people who have a decreased income have got some at least mild depression. This is very income reduction dependent on how depressed you are. This is a clinical depression scale, yeah, we're using here. Okay, and then my last slide. So how supportive are you of your government? And we asked many different questions, but it's the local authorities. So how supportive are you of the measures that your local authorities have put in place? Because of course, some countries have a federal system or even got very local rights to sort of restrict people's movements. Okay, so how supportive are you of these local measures? Look, Germany, the dark bar we're extremely supportive very supportive of what our governments have done. And so this is not most recent, this is the latter part, the second half of 2020. So Germans were in that period of time very supportive. Not far behind the United States, really. 80% of Americans that took part in our survey sort of were supportive here. And look, in the United Kingdom, very hard lockdown there, very restricted in many places, and very high death rates when compared to Germany. It's a very high numbers of deaths, this is how I should say it, from COVID, and Argentina much less supportive. Okay, so if you are curious about the questions we asked and about the insights that we got besides the ones that I've mentioned here, go to our website, livewithcorona.org, and you can also follow us on Twitter, either our Live with Corona Twitter account or my Twitter account personally. Thank you very much for your attention.
Thank you very much, Anke, for this fascinating snapshot, so global snapshot really of where we are right now with COVID. And I look forward to getting into some of the details of that as we get into the discussion. But let me turn now to Dr. Bill Colglazier. Bill, the floor is yours. And actually, just a reminder, if you're not, if you just make sure that you're all muted while we have the presentations, I think that'll help with stability. Bill, it is yours.
Thank you, Kathleen, and thank you, Anke. Very interesting results. I was particularly surprised by the response in the US to your last question. I would have thought support for government actions, even at the local level, would have been less than you found. I'm a physicist who has spent most of his career sort of at this interface of science, public policy, and international affairs, particularly focused on the role of science advice. So I'm going to discuss briefly 4 topics. What have we learned about the science policy society interface from this pandemic, or at least what I think I've learned? 2, can we translate what we've learned into actions to do better in defeating this pandemic? As we all know, it's not over, as well as the next worldwide pandemic and our other global challenges, whether it's climate change, biodiversity loss, social and economic inequalities, and so on. What can science communities facilitate our societies doing better in the future on all of these challenges? And what is the special niche of the Humboldt Foundation in contributing? First of all, what I've learned, I thought the US had the most sophisticated science policy society interface and the most robust science advisory system of anywhere in the world. And the US response, in my view, at least initially, but continuing in many areas, was catastrophic. Why I was so surprised by the inadequacy of the US response was that the threat was well known by many scientists, economists, health experts, security professionals, inside and outside the government. There were detailed plans that had been prepared about what to do, that even been the equivalent of sort of war games, lessons with previous pandemics from 2003, SARS, Ebola, avian flu, MERS, and other pandemics. And the US responses in responding to the pandemic were not just the fault of the politicians and the political divide in the US. There were also mistakes made by scientific institutions in the US with testing, stockpiles of personal protective equipment, muddled messages on public health measures. And it was more than just the science policy interface. The political divide in the US, and many American members of the public view the pandemic as a hoax, and many still do not want to agree on wearing masks or even social distancing, sort of an issue of personal freedom. So these interacting failures among science policy and society resulted in many more deaths, much misery, affected US national securities. As we all know, a number of other countries did better, and the reasons are probably from a number of sources, whether it's Taiwan, Korea, New Zealand, Germany, Finland, Rwanda, and part of the reasons, of course, were greater social cohesion in society. So all of this reminded me of something I'd forgotten to emphasize when I was in the State Department talking with many scientists and government officials in other countries about strengthening their science advisory ecosystems. And what I had tend to forget was that for important policy decisions, what matters as much, if not more so, than science or culture, values, ethics, trust, leadership, history, and politics. They're obviously powerful determinants of decisions of political leaders and the public. And they can only be changed and affected by the will of the public and its leaders. So the societal aspects cannot be ignored. And the challenges at this stage in the pandemic are especially complex because of uncertainties about the future path of the virus, certainly the variants, the economic impact, individual behavior, the availability of vaccines and therapeutics, and of course, government policy at the national and the global level. And all of these uncertainties increase the complexity of the challenge. And as the virus has evolved, some of the countries with early successes have not done as well. Anke referred to the challenge in the distribution of vaccines and availability in the EU, the current tragic situation in India, the problems in Brazil, and a number of other countries. But a great success of the response to the pandemic has obviously been the response from the scientific community, unprecedented scientific collaboration and sharing of information that accelerated from the very beginning, new diagnostics, therapeutics, vaccine development, and especially the new mRNA vaccines. Complicated, of course, in terms of our response by vaccine nationalism and the lack of a well-coordinated response at the global level. As one wise person said, even the most self-interested person or nation has a vital interest in global pandemic suppression. So how can we do better? One aspect is well illustrated by a very nice report that Kathleen just brought attention to me, and it's actually from Vanderbilt University, and I think a Humboldtian was one of the authors. It's entitled "Improving Pandemic Response: Global Lessons and Cultural Insights from COVID-19." The report addressed mainly the health community as well as decision makers, public health decision makers. And just among the topics that are discussed in the report are: one, health policy needs to account for cultural understanding of disease. Leaders should mobilize shared values to increase support for public health efforts. Health authorities should engage communities to build trust. Public health agencies need to identify the cultural factors that shape resilience and vulnerabilities. This report had much in common with some of the things that I wrote last year about 4 tasks that I thought, or duties that I thought the scientific community should address if we have a hope of leading to wiser societal decisions in the future. One was the creation of trust and shared values between scientists and the public, and between scientists and decision makers, which really requires more engagement with the public. 2, reinforcing a duty of scientists to communicate clear and accurate information, counter false information, tell the truth no matter what the government says. Creation of a duty for scientists to ensure that the public and the government are promptly made aware of the challenges, the threats, and the opportunities that emerge from the rapidly advancing science and technology revolution. And lastly, creation of a duty for scientists to marshal knowledge to help achieve aspirational goals from our nation and to address some of the failings of our societies. Efforts to strengthen the science policy society interface have also come from the UN. There's a very nice report I would also recommend. It's well worth reading, called "The COVID-19 Pandemic, a Wake-Up Call for Better Cooperation at the Science Policy Society Interface." It emphasized the need to share knowledge and data internationally, to promote collaborative research, to ensure universal access to solutions, and to act with greater urgency on global scientific assessments related to our many global challenges. Nevertheless, it's entirely obvious to all of us now, wise political leadership is essential. Changing the aspects of a culture without political leadership is hard. We need to effectively, in my view, we need to effectively connect what we have learned from this pandemic and our responses to it to achieving our other national and global goals. So what is the special niche, in my view, of the Humboldt Network? I'm not a Humboldtian, but I joined the Board of American Friends because I think the U.S. can learn a lot from the experience of what Germany has done in creation of the Stiftung. The foundation funds scholars and fellows, as we all know, in all areas of sciences and humanities, including history, cultural studies, philosophy, and ethics. And we need the insights from all of these disciplines of the knowledge revolution. It's moving much faster than the evolution of our societies and our politics. So I think utilizing the Humboldt Network to help inform our political leaders and public, do it in an ongoing way, learning and helping to advise on when mistakes are made, trying to advise on how we might do better, and have this done in partnership with policy and society, communicating and listening to the public, I think is essential if we are going to find pathways to a more sustainable future. So thank you very much. It's a pleasure to be with you today.
Bill, thank you very much for this very incisive analysis of particularly the science policy connection, but how that must relate to society and some of the factors, the picture that Anke Hoeffler is looking at. I want to let all of you know, please encourage you now to please share any comments or questions you might have. I'm going to start off with a few questions. One of the things that struck me, and this has become a central theme throughout the past year, is about public trust in science, also public trust in government. And Anke, I'd like to start with you and wonder if you might delve a little bit deeper based on the data that you've been collecting globally. How are we doing with public trust in science? And also in government? I was actually surprised by your last slide showing that there was quite a bit of acceptance for local government measures. I don't know if you find that picture shifting. And then, Bill, I'd also like your take on this question of how do we address this issue of public trust, both in science and in government. But Anke, let's start with you, perhaps.
So we asked about trust, and we asked about trust in a way that social scientists have done it previously so that we can compare. So we didn't have a question on do you trust science, but what we have got is do you trust healthcare professionals? And that trust is really high. And that is high. So we ask, how much do you trust your family, your neighbors, your police, So this goes down, yeah? So I trust my family and I trust my neighbors, but a little bit less. And so it goes down. But the healthcare professionals is really high in comparison. And it has remained so despite of the sort of forwards and backwards discussion about the testing, how many false positives we get and all these things that have been in the somebody's microphone is on, not mine. Well, mine, but it's all quiet here. Okay, so the trust in government, local government wasn't actually trust in measures. I might have misspoken there. I mean, you could agree with your local government if they don't do anything. Yeah, because you are of the opinion.
Hang on one second. If I could ask you, make sure, yes, please make sure you're muted if we just have the speaker muted. Thank you, thank you. Sorry, Anke, please go ahead.
That's all right. Happens to the best of us. So, okay, I think it's Louis Bart. If I can see this, there's a sort of microphone not on. Or microphone is on. So the trust in government, in national government, is decreasing in Germany. And we've got a lot of responses now from Germany, and this is going down because you were asking how does this sort of compare over time. The US, I need to have a look because of course you've had a change in regime, whether this has sort of really gone up. But the trust in local government, of course, could be, I agree with the measures, but measures could have been, a curfew, or could have been do nothing. Yeah. So it's just agreement with the local government. Thank you.
You're muted, Kathleen.
Okay, a year into this and I'm still making the mute problem. Sorry. Bill, I'm curious on the trust angle of this, because part of this is also about the way that we communicate science to government policymakers at different levels, but also to broader society. And I'm wondering, are there discernible lessons already about things that we have learned about how do we communicate in a way that enhances trust?
I'll give you one I guess optimistic view from the response to the pandemic. The fact that science has done so well, at least we can have a hope that maybe the trust will be increased, at least in some sectors, that because of what science has contributed to dealing with the pandemic. Although on the counter side in the U.S., many health professionals have been attacked. Part of the political divide that exists in the U.S. But in terms of how to increase trust, I'll give you an example of one that impressed me. It actually came from a different area. After the Deepwater Horizon accident in the Gulf of Mexico, which the BP oil well, the national academies in the U.S. were given funds from that to go and try to talk with communities along the Gulf Coast about the resilience of communities. And what they found by doing that, just the fact of the scientists going out and listening to these communities, asking them, what was resilience in their interpretation for their community? What were the needs that they had? Just the fact of listening, not just talking and telling communities what they might do or should do, actually help to increase trust from these communities and to listen and have a dialogue. So engaging with communities about these issues can actually, I think, help to build trust.
Thank you, Bill. I'm going to turn now to, we have questions. We have a question from Enno Aufderheide to Anke Hoeffler. You showed that the stress level was highest with those 36 to 45. I found that interesting as well. Is that related to childcare duties? Is it related, is there data about people living alone? Why the high stress level in the 36 to 45 year bracket?
conjectures utterly correct, because we've got some other, questions, and the people who are most stressed are those with children. And then followed by people who are living alone, and then followed by people, but that's, in the very young age group and in the very old age group, of course, this is where they're heaped. And then interestingly, those who live as couples seem to do relatively well.
Interesting. Very good. Next question is from Ramesh Singh. Wondering how, Anke, how did you reach out? How did you identify or reach out to the many people who participated in this survey? That is an interesting question.
So I've learned a lot in the last year on this. So first I sort of forwarded this to friends, and they, and to, universities and so on, and sort of let it snowball. But yeah, that gives you a trickle of response, and you tweet about it and so on, but it's not a lot. So it's really important to have local partners. So even though we live in this digital world, and it shouldn't really matter, having, so the second most responses were from Portugal. Okay, Patricia Justino is Portuguese herself, and my one of my postdocs is also Portuguese, and so they were able to give interviews in Portuguese, and language matters a lot, so that our survey is available in so many different languages certainly helps. But for example, people don't want, so the institutes that collaborate with us, they don't want the answers in English, they want them in Spanish, they want them, and so that took us a time to understand, because even only if they have some insights can they then publicize the next lot, and roll on. And then the big thing we understood was how to do this with the media. So I'm maybe an old-fashioned person who still sometimes reads paper newspapers, but a lot of people, of course, read them digitally. And so we had consortium of Munich newspapers who put a banner under every single Corona article, and sort of click here. And it generated thousands of responses, And we sort of said to the newspaper consortium, if you do this, so this is the same banner for, 4 or 5 different newspapers. If you do this, then we analyze the data for you by borough for Munich, by rural, urban, by, whatever interests you, where do the most depressed readers live, and so on and so on. So where the biggest income losses. And so we did this for Chemnitz, Freie Presse in Saxony. This is at the moment a complete hotspot of Corona. And there, interestingly, people do not trust the government at all. This is a long way from Berlin. In Berlin, when we had all this detailed Berlin data, people trust the government, to a really high degree, 80%. This is recent data. But in Saxony, they don't. This might be for many different reasons. I mean, it's also a hotbed of, so you see all these querdenkers, so these people who are sort of saying, oh, this is all nonsense, and Bill Gates is trying to infect us here, and that kind of mix of anti people. There's a really strong right-wing element. And this is again where politically they live, and so there's an enormous pushback against the government there. But that's basically my answer to you. If you want to recruit people online, then it's best to recruit them through a medium that is already online and where you can persuade a newspaper, because there's something in it for them. They find out a lot about their readers.
Yeah.
And who answers these questions and so on. And so obviously that we don't give them the individual, I mean, that would be wholly unethical, we don't do that, but we give them some sort of general feedback. And that's the best way of doing it. And I would love to persuade somebody in other countries to do exactly the same sort of thing. I'd love to have this for Chicago or Jakarta or anywhere. Thank you.
It's a fascinating example also of collaboration between science, in this case, private sector, but it's a win-win. I can see that. We have a question from Dominic Guess. Do you have data on the effectiveness of certain regulations and measures, basically that would show the relationship between measures taken, a lockdown, distancing, masks, and the number of COVID-19 infections or the number of COVID-19 related deaths. Has that connection been made then between the data, Anke, that you're collecting in your project and what we know about infections and deaths from COVID-19?
This is a really good question, but I think our data are not sufficiently finely grained to really look at this. What I can say from our data is, because there's some other data sets that track the restrictions that different countries have included over time. Yeah, so there's an Oxford tracker, for example. We know that people voluntarily took these measures before they became law. In many countries, we can see this quite clearly, that these sort of avoidance and the non-pharmacological behavioral measures, set in before they became mandatory. And I find that really interesting because, of course, there are some countries that have never mandated very much, like Sweden, and they don't look all that different in many aspects. So, but no, I don't think I can tie it precisely to that, because we've also, I think we just haven't had enough responses from some countries to really track this.
Thank you. To Surya Raghu, asking whether we could provide references. Bill, I'll come back in a second. On the UN report and the Vanderbilt report, which actually Ted Fisher is a Humboldtian, and he had RSVP, but I didn't see him quickly. I thought I was going to do a cold call on him, but we will put references consider it the show notes for our dialogues. We will put those references that you can access them. Bill, you wanted to come in, I think. Sorry.
Okay, I was just going to comment. U.S. newspapers like the New York Times have looked at some of the issues in the U.S., particularly since we ran an experiment of 50 states, since it was a very decentralized system with governors being, in many cases, having the main responsibility for saying what was allowed and not allowed in terms of public health measures. And of course, the kind of things came out that you might expect, and what you'd call the red states, which are things were much looser. Infection rates were higher than in the blue states. So that I don't know if anyone is actually doing a more rigorous scientific analysis of the data, but we did run this fascinating experiment in federalism. If I could also just mention one other thing about, because there was a question about science communication there. The U.S. National Academy is also, for the last couple of years, is doing a very interesting outreach on science communication. And again, this is an area where there are scholars who study this, the effectiveness of different ways of communicating with the public. And again, among the lessons, again, similar to what I mentioned with that Gulf Coast issue, is the extent to which scientists are willing to listen. This is important as what they have to say in terms of building trust and having very effective measures to communicate to the public.
I want to weave in one additional question on science communication, because what struck me in the early phases of this, and I think was actually the president of the Humboldt Foundation, Professor Papa, who talked about the pandemic as really, for those who really don't understand how science is done, what it is, it was an ongoing real-time lesson in science. And I saw that at the time as a very positive thing, but I think we've also seen some of the negative effects about that. And I'm wondering if there's anything concrete, particularly if we're thinking about training of next generation scientists and scholars, that might come out of our experience in dealing with this ongoing building of knowledge about the coronavirus, about effectiveness of measures, but also about vaccines. Or is it too soon to talk about lessons? But are there some concrete lessons, particularly in communication about science, on something that is a moving target? Any thoughts about that? Bill, can I?
Sure. Well, one of the challenges obviously comes from the fact that there are uncertainties in our scientific knowledge, and being able to communicate that to in public communication, that at any one particular point in time, the health experts, the Tony Fauci's of the world, are given their best advice based on what is known. But the uncertainties and some of that advice may change over time. Which sometimes leads to health experts being challenged or saying that they didn't tell the truth back then, so why should you trust them now? So trying to convey both, the scientists are doing the best job they have, but there are things that science doesn't know at any particular time. But of course, as we all know, science continually learns and corrections can be made. But that's a difficult communication challenge.
Anke, do you have thoughts? Yes, please.
Yeah, so science communication, I think Bill already hit the nail on the head here. It's about the uncertainties, and that's very difficult to understand for people who don't know anything about probabilities. But I think what I can also see is that the resistance to take these measures, the resistance to get vaccinated and tested is particularly high in minority communities, and sometimes for good reason. Yeah, so Black Americans have had a very, very bad experience in the past with the public health system. Yeah, and not public health system, but with tests that have been, without consent, terrible stuff has happened. So quite rightly, they are less trusting. And in Germany, I can sort of see that in particular, the sort of, the pandemic has shown us very dark sides of our societies. Yeah. So, for example, we saw in the United States and in Germany that the meat packaging industry, or these people were at particularly high risk because it's cold there. They are working in close proximity and they shout over all of this noise, and so the transmission was much higher. There's so many, and then they're contract workers, and they have very little buy-in into this society here. They're very difficult to reach, and it's a particular challenge to communicate the importance of all of these measures and vaccination. And Bill was sort of saying about reaching out is really important. So in the United Kingdom, I think 95% of all people who've been offered vaccination took it. But again, in minority communities, the uptake wasn't so good. And they've gone from house to house, because this is how you've got to really reach out to people.
Thank you. We have a question from Stefan Mehlich. What was the most surprising finding? Was it the rather positive evaluation of US government measures, or anything else, Anke, that you didn't expect, your team didn't expect? Any surprises here?
Yeah, so I was surprised by how America first came through in the survey. That was one surprising issue. And then another surprising issue was that people have understood about the health worries, but the stress to do with everything else around the pandemic seems to be so much higher in that middle age group. And that I didn't actually expect. I expected people to be really stressed because of their health worries, but that doesn't seem to be directly connected. A lot of other things is very intuitive, but it's good to know, because then you could actually target policy responses. So, for example, women are carry a much higher burden in the pandemic. They are more likely to quit their job. They take more household chores on. They do more homeschooling, all of those sort of things. So we really have to sort of consider women differently. And also these income losses on the self-employed, it's not that surprising, but it directs policy effort, or should direct policy effort.
Thank you. We have a question from Godrat Karami. How do you differentiate the outcome of your surveys between the rich and the poor countries?
Sorry, how do I missed that?
How do you differentiate the outcomes of the surveys if you're looking at rich versus poor countries? Are there discernible differences there that can be identified?
So unfortunately, we don't get a lot of responses from low-income countries. Yeah, so you don't need a computer to do this survey, but you need internet. Yeah, but you can do it from your mobile phone, and a lot of people have a sort of smartphone that allows them to do it. Because we haven't got that many answers from low-income countries, in particular from Africa, which is the poorest world region, we applied. So on the back of this survey, we applied for funding from the German Ministry of Education and got a $500,000 grant to sort of phone surveys in poor African countries. This is ongoing at the moment, because reaching out to people again will be much better, to sort of elicit some responses. So it's a slimmed down version of our online survey, but the same, picked out a few questions so we can compare. So hopefully in the next digital format, I can tell you, give you a much better answer on that. So for example, we have a lot of questions on food insecurity, and that doesn't seem to matter all that much at the moment, but I think the more we really ask, poor people from poor countries, then that'll give us a clearer picture, hopefully.
Well, I'm waiting to see if there's a couple more questions. I wanted to come to the question of international cooperation. I was really struck by the graph showing that U.S. has been the most self-focused, saying we should get the vaccine first. A lot of support for a more national first, America first policy in this case from a new administration, compared to other countries. And then on the other hand, Bill, what you had sketched out, the urgent need for better international cooperation. And this is where a case I think we see there is a huge gap here. How could we move forward to encourage more international cooperation? God's concrete. How do we begin to bridge that divide? I know that's a broad question. This is a huge issue, but I was really struck by where public opinion seems to be from the surveys and what we need to see emerge, not only for this pandemic, but the next pandemic or complex global crises like climate change. So Bill, any thoughts on that? I wonder if were you struck by that as well, that particular slide?
Yes, of course. And actually, I have a suggestion for Anke if she's going to continue her work and go beyond the public health issues to deal with issues like climate change. It'd be very interesting to ask these segments of the public in different countries, what they've learned from the pandemic that's related to some of the other big challenges that their countries face, as well as the globe itself faces. This issue of international cooperation, I think most people understand that things they're only going to get close to normal for their countries if it's getting close to normal in almost every country around the world. To what extent have they sort of internalized that message? The fact that SIDE has actually collaborated successfully across cultures, even when their governments were at loggerheads during this pandemic. So yes, I would hope you might think about continuing your surveys, looking at other issues, and also what does the public learn from this experience with the pandemic.
Okay.
Thank you. Happy to take up that challenge. We did ask people in the survey what they think the biggest challenge is, and one option was the climate change, and the other one was the pandemic. And people still sort of say it's climate change. So in particular, younger people, sort of say that this is so. That's the only information I have so far on this, but. So on international cooperation, what, have we learned something here? I think this sort of like, I want to be vaccinated first is because it offers me some local reprieve from all of these measures and a return to life pre-pandemic. It doesn't include international travel, of course. I think that's going to be the last restriction that's going to go. But that doesn't matter for a lot of people. I think in particular in the United States, not a lot of people travel internationally. So it's quite understandable for me that this isn't, that they can compartmentalize the local and the global. We don't, because we'd rather meet, somewhere. I would love to be, with you in person, and I'd quite like to travel. But for me, this is a different issue. I think that question of finance. So we've never really spent serious money on climate change, and all of a sudden there was all this money available. And if you want to be really mean about it, it's about saving some old people's few last years of life, because that's these are the people who died overwhelmingly, they're very old people. And so it's not, if you start talking in terms of years of life, you haven't saved actually that many, and if you sort of scale up and sort of say, okay, globally, this is really something for all of us, no matter how old we are and where we live, this is a challenge. Maybe that will sort of jumpstart, and I can see why Biden is sort of immediately on the ball on the next big topic, because at the moment people are really primed, we can take action, we can spend money, and I think the shift is also really obvious in Germany, towards the Green Party at the moment.
Okay, we are coming near the end of our hour. There were two questions which I'm going to put out, and I'm going to ask Bill and Anke to make any very brief statement. Then I'll turn to Enno Aufderheide for some closing words. We have a question about the conflict on IP rights versus public interest when it comes to the COVID vaccines. Are there any comments from either of you on that? And second, a question whether the international institutions that we have right now are sufficient to deal with global public health issues, or whether there are alternative entities that might be needed. So I don't know, let me perhaps go in reverse order. Bill, if any quick closing thoughts, and then we'll turn to Anke and then to Enno.
Yes, on both of those, on IPR, because there is a loud cry for the US to remove some of the IPR on the mRNA vaccines. I don't think that's going to happen. I'm not sure that's a good thing, actually. The reason why we have this remarkable advance in terms of vaccines was the fact that there was a great incentive for entrepreneurs and companies to develop them. However, I think the issue can be dealt with. I think we do have to vaccinate the world. And in many cases, that's going to require money, and that's going to, particularly the advanced countries, being able to provide vaccines to many countries around the world. So I'm not sure the answer is in stripping the IPR rights. On the second issue of international institutions, the World Health Organization. The World Health Organization, many of its restrictions and constraints actually come from the member states. I think there's a lot that can be done to improve the performance of WHO, but it's going to require convincing the nations, the member states, to control it and set up the constraints to ease them. There are lots of analysis and work being done, making recommendations, but it really is ultimately going to depend upon the nation's governments, the governments of countries, to actually make the WHO more effective.
Thank you, Bill. Anke.
Well, it's difficult to follow on these very competent answers. On how the vaccine rollout should be happening, maybe, I mean, we've had a similar discussion on HIV/AIDS and the antiretroviral drugs that were again developed, privately with profit incentive, and were so desperately needed, and were then made available at prices that really, I mean, if you look at South Africa's life expectancy, for example, that was at 56 years, and then after antiretrovirals came in, increased rapidly over time. And so I'm hopeful that we can come together again and find a solution to provide vaccinations. But unfortunately, the most recent, it's different from African country to African country, but Malawi, for example, is going to probably incinerate a lot of vaccination doses because people don't want to be vaccinated. So again, it's this reaching out to people, get vaccinated, is important, of great importance. Thank you.
Thank you very much, Anke. Let me turn now to Enno Aufderheide for some closing words. Oh, Enno, you're muted.
So I hope it works now. Yes, thank you. Well, first of all, of course, I also thank the speakers, Anke Hoeffler, Bill Colglazier, for sharing those insights, for those really, really inspiring talks. And there's a lot of food for thought. Thank you very much. And I thank the American friends, because I think you have really created a showcase that the Humboldt Network provides very different perspectives from people who are scientists and still in research, or still in public service, or in the industry, and we will see that in the upcoming events. these different perspectives from researchers, from critical minds who are willing to ask questions also beyond their narrow area of expertise, or, well, from, you may say, citizens of world that are willing to think internationally and engage in action for the future of our being on this planet. So I'm very, very much looking forward to the events that are still coming, and grateful for the event that we have behind us. And since, as you said, these are concluding remarks, I would also want to end by acknowledging the personal challenges that so many of us are facing in these days of the pandemic. Anke Hoeffler's data have made this transparent, but very many of us are experiencing it each day. So I hope that you can all stay safe and in good health, and that hopefully that is true no matter whether you are in the United States or in Germany or in any other country around the globe. So thank you, Kathleen Fisher, and the American Friends. Thank you, the speakers. Thank you, the audience. And I'm very much looking forward to the next event.
Thank you, Enno. I want to join Enno in thanking our speakers, Bill and Anke. I also want to thank those who made it possible. That was the team behind the scenes, my colleagues Alanka Oswald, Alexis Brower Anker. My friend, thanks also to Katrin Amian at the foundation who helped us, and the board for guiding the evolution of this series. Please stay tuned for future invitations. We hope that you can join us in this future exploration of the science-society policy interface. And please stay safe and well. Thank you very much, and we will see you soon. Goodbye.
Goodbye.
Take care, everyone.
Take care.
Thank you.
Take
Bye.
care.